Status epilepticus. Welcome to this session on status epilepticus. Status epilepticus is a medical emergency which can have several severe long-term consequences. Hence, proper understanding of its pathophysiology and management is extremely crucial for healthcare professionals. By the end of this topic, you will be able to define status epilepticus, describe its pathophysiology, and explain in brief a case of status epilepticus. The word epilepsy is derived from the Greek word epilepenion, which means to be overwhelmed by surprise or to be seized. Epilepsy is a serious neurological condition affecting 1 to 2% of the population, which is characterized by recurrent unprovoked seizures, sensory disturbances, and loss of consciousness. Among all forms of seizures, status epilepticus, or SE, is a neurological emergency and is considered as the most extreme form of epilepsy. The Commission on Classification and Terminology and the Commission on Epidemiology of the International League Against Epilepsy have proposed a new definition for status epilepticus. It is defined as a condition resulting either from the failure of the mechanisms responsible for seizure termination or from the initiation of mechanisms, which lead to abnormally prolonged seizures. It is a condition which can have long-term consequences, including neuronal death, neuronal injury, and alteration of neuronal networks, depending on the type and duration of the seizures. The duration of the seizure, as per the revised guidelines published by the Neurocritical Care Society, is 5 minutes or more of continuous clinical and/or electrographical seizure activity. They may be convulsive, non-convulsive, focal motor, myoclonic, and any of these can be refractory. Seizures involve abnormal electrical activity of the brain, affecting both the mind and the body. As per the data published in the journal Epilepsia, the incidence rates of SE ranges from 3.5 to 41 per 100,000 per year in North America, 9.9 to 27.2 in Europe, 1.3 to 5.2 in Asia, and 10.8 in Africa. Status epilepticus has a bimodal age distribution, with peaks during infancy and in the elderly. Status epilepticus is more common among the male population. The proportion of status epilepticus is 16% to 38% in children, to 42% to 50% in adults. Let's look at classification of status epilepticus. The Commission on Classification and Terminology and the Commission on Epidemiology of the International League Against Epilepsy, or ILAE, have classified SE based on the following axes: Semiology, Etiology, EEG correlates, age. Axis 1. Classification based on the semiology. 2 taxonomic criteria were taken into consideration, and these include motor symptoms and impairment of consciousness. With prominent motor symptoms: convulsive status epilepticus, myoclonic status epilepticus, focal motor, tonic SE, hyperkinetic status epilepticus. Without prominent motor symptoms: non-convulsive SE or NCSE, NCSE with coma, NCSE without coma, generalized and focal boundary syndromes, epileptic encephalopathy, acute forms of coma with status like EEG pattern, epileptic behavioral disturbance and psychosis, confusional states or delirium with epileptiform EEG changes. Axis 2. The underlying etiology of SE is categorized based on a known disorder, which can be structural, metabolic, inflammatory, infectious, toxic, or genetic. Based on its temporal relationship, they are subdivided into acute, remote, and progressive. Known, symptomatic. Acute, example, stroke, intoxication, malaria, encephalitis. Remote, example, post-traumatic, post-encephalic, post-stroke. Progressive, Example, brain tumor, Lafour's disease, dementias. Unknown, cryptogenic. Axis 3. Classification based on the electroencephalographic correlates. 1. Location, generalized, including bilateral synchronous patterns. Lateralized, bilateral independent, multifocal. 2. Name of the pattern, periodic discharges, rhythmic delta activity or spike and wave, or sharp and wave plus subtypes. 3. Morphology, sharpness, number of phases, for example, triphasic morphology, absolute and relative amplitude, polarity. 4. Time-related features, prevalence, frequency, duration, daily pattern duration and index, onset, sudden versus gradual, and dynamics, evolving, fluctuating, or static. 5. Modulation, stimulus-induced versus spontaneous. 6. Effective intervention, medication on EEG. Axis 4. Classification based on age. 1. Neonatal, 0 to 30 days. 2. Infancy, 1 month to 2 years. 3. Childhood, greater than 2 to 12 years. 4. Adolescence and adulthood, greater than 12 to 59 years. 5. Elderly, greater than or equal to 60 years.